Any other board business? Public comment? Floor is yours, Matt.
Thank you. So, hello, everyone. First off, I just want to thank everyone on the board for your years of service, especially those of you that in their many, many years. And I want to thank everyone in the room who helped create and draft the strategic plan for Jefferson Healthcare and drafted it last year, and we're still refining the process. The strategic plan has made us stronger, has made us more focused. It helps clarify what our priorities are. It helps me in my job, and it helps every director. That said, I feel like there is a major gap in the strategic plan, and it's a gap that is, I think, important to the health of the people in our district, and it's a priority that should be at the top of every hospital district and every public institution in the country, and that is access to healthcare. Everyone needs access to healthcare, and access is a problem. It's a problem in our district. It's a problem throughout our country because we have an inequitable healthcare system, because we have an inequitable multi-payer healthcare system. And this institution is a cog in that system. And you guys, I know you work incredibly hard to try to do the best you can for the people in our community. And I know you all care about the people in our community deeply, and you do not have an easy job. There's a lot of problems that you're juggling. Over the last 2 years, I've started to meet people that suffer from painful medical conditions, and they don't even go in to seek care, or they delay it until it gets really, really painful, and they have to go in. And they don't go in because of the financial barrier. As I started to become aware of this, I started to research it to see if there's any data, any metrics we can look at to actually assess this problem. And I'm sure you're all familiar with the Center for Disease Control survey they do, the behavioral risk factor surveillance system. They do that every 2 years. Every county in the country is surveyed, and they ask people in the last 12 months, did you not go to the doctor due to cost? And in our county, it's 14% said in the last 12 months I didn't even go in the door. The Kaiser Family Foundation, they did another study. They asked a slightly different question. They asked, in the last 12 months, did you avoid or delay seeking health care due to cost? You ask it that way, it jumps to 29% nationally. We don't have data on our specific county with that. That is a lot of people in our county that they're not even coming in our door seeking help for their conditions. I'm sure you all are familiar with the consequences of not getting prompt medical care. Obviously their suffering will continue. It impacts their quality of life, their ability to hold a job, take care of their family, and of course it's going to lead to worse outcomes. In the worst cases, they're going to end up eventually in our emergency room, and it's going to cost us more, it's going to cost them more. And it's going to cost them more financially, and it's certainly going to cost them more health-wise. There's studies showing that just the financial barrier to healthcare leads to death. It leads across the nation, 45,000 deaths a year in people that just don't have insurance at all, which is just one type of financial barrier. So I'm here today to ask you to take some steps to try to alleviate this problem. I know this organization does a ton of charity care, more charity care than any other institution. We're very high in the amount of charity care we do. But charity care is not a solution. I'm not asking you to just do more charity care. That is not a solution to this problem. The Affordable Care Act, going full implementation next year, is not going to solve this problem. The General Accounting Office has released a study showing it's going to leave millions of people still uninsured in 2016. The ultimate solution is single-payer healthcare at the state level or federal level. I don't know if everyone on the board supports that. I hope you do, and I hope when you get to sit down with our state and federal legislators, I hope you're you're pushing for it, I hope you're saying, what are you doing to make single-payer healthcare happen? Because that's the only solution that's actually going to, the financial, in a reasonable way, solve this problem. But there's also another thing you can do. One is declare it a priority. Say, this is unacceptable, that 14 to 29% of the people in our county have a huge financial barrier to healthcare. Declare it a problem, put it in our strategic plan, challenge us to reduce it, and then give us an aggressive goal. Because the way we function here is the strategic plan drives what we do. So if it's not there as a goal, you're not asking us to invest resources in doing it. We should be looking at this problem and systematically breaking it down. There are a few small communities, local communities, that have taken this head on. San Francisco took it head on, stopped waiting for the state and federal government to solve it. They created a program called Healthy San Francisco. And it created affordable access for 85,000 people in that city. Howard County, Maryland saw what they were doing, created a similar program called Healthy Howard County, also very successful. Snoqualmie Valley Hospital District created a program called Snoqualmie Valley Affordable Access Program, a little less ambitious than those other two programs, but also made a big difference. I'm convinced we should have someone here whose job is access, and their metric is people reporting that they are not going to even coming through our door. And they should be studying these programs, coming up with ideas for more innovative programs, looking at what's going to change with the Affordable Care Act, because you'd have to do it differently starting next year than San Francisco and Howard County. We'd have to be innovative again. The landscape's going to change. We can do this. We can make a difference here. But it starts with the people in charge. You have to make it a priority. And the people in this room who have the power to say what our priorities are. So that's what I'm asking. I'm asking you, say access to healthcare is a top priority of this hospital district. Put it in the strategic plan and give us an aggressive goal, a timeline to try to get this. If we get it down to 5%, we're number one. That's no county in the country does better than 5%. But the goal should be 100%, right? 100% of people have affordable access to healthcare. So thank you. That's my comment.
Thanks, Matt. I think, interestingly, there might be someone standing in a public hospital district in another part of the state pointing to Jefferson County for our level of unfettered access to care. And because this is my third public hospital district, and this is the only public hospital district that truly allows patients with or without insurance to sign up for a primary care physician. And the barriers to entry and access for elective procedures are far less here than those other two hospitals. And I think that that's reflected in the amount of charity care that we provide. Secondly, I think we're starting with a lower problem based on the responsible work of this board, and based on it being a priority, whether it be in our strategic plan or not. Secondly, the Affordable Care Act, particularly the Medicaid expansion, I think is going to have a huge impact because members of our community now who don't qualify for Medicaid will, several thousands of them will. So it is going to be a job of Kate's to aggressively reach out to those members of our community and sign them up through the Medicaid expansion program so that they do qualify for insurance and that they do have access to care. And I guess lastly, that I think it's important to point out that Healthy San Francisco is a program that was started and administrated by the city of San Francisco, and has other funding sources above and beyond a public hospital district. We certainly would be happy to sit down with the county or with the city any time to talk about what those other funding sources would look like. But I think it's reasonable to suggest it would be challenging for a public hospital district of our size to take something like that on in its scale, but kind of continue doing the work that we're doing. So lastly, I think we're in agreement that access is important, and whether it's in the big five of the strategic plan or not, it will be something that the organization works on and continues to value.
And I'd love to talk to you at length about a program that actually Chuck and I chaired several years ago that was way before we started employing the docs, at their request, of course, that culminated in a meeting with the Insurance Commissioner's Office in Olympia, where we had come up with a plan to work with KPS at the time to they would provide a catastrophic health insurance plan to enrollees. We then would charge a stipend for anyone who wanted to be in the program, and then we would cover the deductible, and then the catastrophic would kick in after a certain length of time, after a certain period or a certain amount. But when we got to Mr. Kreidler's office, his top legal and assistant that we were meeting with told us that what we were trying to do was illegal, and suggested a two-pronged attack. One through the legislature because we were selling insurance in effect. And one was to talk to the legislature about changing the law, and the other was to get an exemption from the Insurance Commissioner's Office, both of which would be extremely expensive and time-consuming. And so for that and other reasons, we did not pursue it at that point. But I could go into a lot more detail with you on that, what happened and how it came about.
Can I say another thing? I just want to say I've talked to Vic about that program, and that's just what I'm talking about. That was really innovative thinking. You guys were exploring doing something to improve access, and that, you didn't do that one, but that takes time, that takes resources and energy, and why I think we should be doing that still. We should still be exploring those options, and maybe you gave up too easily. Maybe there was a way around that, the roadblocks that they set up.
You're all welcome to respond. I mean, my response would just be, Matt, we can discuss this more during our campaign, but that I would say that there's no question that access is a priority for the board.
And it always has been, and that's
it
why
always has been, as long as I've been on the board.
we've worked hard to provide that, and will continue.
And that's why we take all patients, insurance or not, and that's unusual both in the region and national.
You made the comment that we should have access as part of a strategic plan. In our organization, that would be like putting up a Post-it note on the medicine cabinet to remind yourself to breathe and have your heart beat. Is such an integral part of what we are, what we do. And particularly now to look at developing a new system with the Accountable Care Act coming down, where 138% of poverty will still get you into Medicaid, that eliminates the assets component, eliminates the conditions you need. Before, it was only up to 78%, where you're going to be able to get subsidized private health care through the healthcare exchange, subsidized up to 400% of poverty level. I mean, to reinvent something now with this coming down, if it falls apart, we'll have to come up with something. But if people in this community are not getting health care they need, it's because they're not coming up to us. It's not because we're barring the door to them. We consistently reach out in our public forums, everywhere we go, at the fair, all of the things that we go to, we're here, come to us. So if you have a way that we get the word out to the people, come on up, we're here, we're open, and we're not going to turn you away. We at one time actually even talked about the idea of creating a charity clinic similar sorry, Mike, similar to the one that they have in Squam. I fought against that for one very simple reason. I don't want the people in this community to lose their dignity by having to go to a facility different. If they lose their job, I did not want them to have to lose the relationship with their physician. Regardless of insurance, whatever changes in their life, they will come to their doctor, they will come to our hospital, they will get their care. Sorry about that. 40 years doing this. You take a little ownership to it.
Any other public comment? Savannah?
Yes, hi, I'm Savannah. And my comment actually starts out as a question, which I would like to ask every board member. And it's gonna.
This is comment.
I know it's comment.
We're not gonna go around it.
I fully respect that, and I honor that, and I know it's not comment, but I'm still gonna ask my question anyway, regardless of whether or not I get an answer. And so here's the question. In the last 10 years, have you had to live without health insurance? Have you had to live without health insurance? Have you had to not go to the hospital or to the doctor to get care because you don't have access to health insurance? And yes, our hospital district takes people who don't have health insurance, but I've lived 95% of my adult life without health insurance, and never have I been able to afford to pay for it out of pocket, even on sliding scale. And the same with my son. I also know a lot of people in this community, not just young people like myself, but families, business owners, elderly people who have not come to receive care because they can't afford it. And so I second Matt's statement on asking that this hospital makes access one of the top 5 priorities for the strategic plan for this year. That's all.
All right, anything else? Thank you, Savannah. We're adjourned.